From here, you're going to take one more deep breath. Pay attention to how much breath it feels like you can get in, and how well you expand in 3 dimensions. And then on the exhale, big exhale, how small in 3 dimensions can you make your rib cage? One more breath to check. And exhale. Good. From here, we're going to take, I like the smaller of the yoga tune-up balls. We're going to take that. We're going to actually work on the front of our shins. So you can do it in a seated position, or also show you a kneeling position. But basically, we're going to be in the belly of the dorsiflexion muscles here. So you're going to find the bony part of the front of your leg, your patella tibial tuberosity, where your patella tendon comes down and attaches, and then the bony side of your leg, where your head of your fibula is. We're going to have the ball right on that spot. I like to find it by finding the bony part of our tibial tuberosity and then just coming right off the edge towards the outside of our leg. So from here, you're going to press the ball in and down towards your foot with one hand, and then add compression with the second hand. And from here, you can do little circles in each direction, or you can even dorsiflex and plantar flex your foot. You can move back and forth. The key is just maintain the compression and that downward motion. And you basically want to just strip out this whole area along your shin. So you can do circles, directions, or foot movement, whatever feels good for you. Sometimes I just like to do a combination of all of them. If, as you roll the ball down, you might have to readjust your hands. You can also twist and notice how that feels. Again, if you can do on the skin, great, because then the ball kind of grabs the skin. You get the added skin stretch with it, but if you're wearing long pants, it's okay to do over your clothing. So I'll show you the kneeling version as well. You're going to, same thing, orient yourself with the ball right on that bony spot, and then bring your knee in to bring the ball right into that area. Now, this is a little bit more intense version than the seated version. So if one feels like too much, or if kneeling on your knees is uncomfortable, go for the seated version, or you can even do both. Sometimes it's good to start with the first version, kind of open things up, and then do the kneeling version to get in. And with the kneeling version, you can go back and forth by dragging your knee forward towards your chest and then pushing it back towards your knees, or you can go side to side and kind of move the muscles the outside of your leg, making sure that you're breathing, and you'll go about halfway to 3/4 of the way down your shin. You might notice that when you get down to that halfway or 3/4 mark, it gets a little bit nervy feeling, because there is a pretty superficial nerve there. So don't smash the crap out of it, like if you find that spot, just go to the side of it a little bit, trying to open up the space around the nerve, not overly compress it. You can also get to a spot where you get down there and you'll put your knee on the ground, and then you can cross your other leg on top to add some pressure, and you can do the foot movement. Here you can do little circles with your foot. It sort of depends on how flexible you are in plantar flexion. After you've made your way down that whole shin, I'm going to have you actually sit back on the bolster and recheck your breath. Because what we're curious about is if this changes your three-dimensional movement of your rib cage. Good. So check it on the inhale and then that full exhale, just like we did before. And for me, I noticed quite a increase in how much my ribs expand on that same side of my body. So that's not necessarily a coincidence. I'm choosing this muscle on purpose because I had a feeling it would have that effect based on how the fascial lines connect in our body. So again, now we're doing the other side. Go to find that tibial tuberosity at the level of the fibular head, and then come right off the bone into the meat. And you can do one hand that does compression, the other hand adds the compression and then goes down towards your foot and do little circles in each direction. You can do twists with your hands, or you can do back and forth in side to side, or foot movement, or all of them. Just exploring, working your way down that shin, and maybe even back up that shin, especially if you didn't want to do the kneeling one. You can spend just extra time in this position. Breathing while you're doing it. Try not to hold your breath. And if you feel your shoulders creep up into your ears, just relax. And that just means that you're trying to add too much pressure. So maybe that is time to go onto your knees and try a little bit more body weight. So I'll show from this side. You're going to find that tibial tuberosity and then come right on the inside edge by bringing your knee in towards the midline. And depending on how much of your body weight is over the ball will also depend on the pressure. Breathing as you're doing this, just stripping out that muscle alongside your shin. Remember, if it gets real nervy, move to a little bit outside that nervy spot so you're not compressing, over compressing a sensitive nerve. As you rock your butt back, you increase the pressure on it, or another way to increase the pressure without as much knee flexion is to lean forward on your knee and then cross with your opposite leg. So the opposite leg body weight adds to it. And we're working our way all the way down, about 3/4 of the way down our shin. Good. Once you feel like you got that opened up, you can come back to our seated position and then check in again with our breath. Inhaling, feeling that width opening up, and then on the exhale, do we get a little bit more of a smaller rib cage position when we exhale? Yeah, and for me, I just have a lot more awareness on that posterior lateral rib cage area down at the bottom of my rib cage.